CSHP Presentation Review Primer, written January 11, 2013, but being read on May 17, 2022. ACPE's definition of CPE. Continuing pharmacy education for the profession of pharmacy is a structured educational activity designed or intended to support the continuing development of pharmacists and/or pharmacy technicians to maintain and enhance their competence. CPE should promote problem solving and critical thinking and be applicable to the pharmacy practice or practice of pharmacy. So what does applicable to the practice of pharmacy mean? In general, for guidance in organizing and developing CPE activity content, providers should ensure that, as for all healthcare professionals, pharmacists should develop and maintain proficiency in 5 core areas. Delivering a patient-centered type of care, working as part of interdisciplinary teams, practicing evidence-based medicine, focusing on quality improvement, and using information technology. So when reviewing a presentation, the first 3 slides should be the following. The first slide is title, name, and credentials, including the employer of the speaker. The second slide should contain a disclosure statement, usually in 1 sentence. Even if the speaker has nothing to disclose, this disclosure statement must be visible. And the third slide should list objectives. And these objectives should be distinct and different for both pharmacists and pharmacy technicians. For as we feel that education on 2 different levels defines to have objectives necessary to be differentiated amongst our staff, our audience members, and our reviewers. The disclosure form from ACPE Standard 6 says, faculty should disclose to the provider with all relevant financial relationships with any commercial interest. In addition, the provider must have implemented a mechanism to identify and resolve any conflicts of interest prior to the education activity being delivered. The activity objectives are as follows. The provider must develop objectives for each CPE activity that define what the pharmacists and the pharmacy technicians should be able to do at the completion of each CPE activity. And in terms of guidance, we have the acronym SMART in order to remember what the objective's main value should contain. S, it should be specific, have precise about desired achievement. M, measurable. Is this information quantifiable? A, achievable. Does the activity objectives align with practice and/or organizational goals? And T, timed. State when the objectives will be achieved, usually at the end of the CPE session. Differentiating the CPE for pharmacists versus pharmacy technicians. The ACPE accreditation providers are required to have a separate list of learning objectives for each audience, specific to what that participant should take away from the activity and apply towards his or her practice or their practice. The provider should know the intended audience when designing the activity. Do not make the activity fit the audience after it is designed. It must be activity objectives written prior to any knowing of who your audience members will be, whether it's a specific demographic region, specific location, specific hospital institution, etc. ACPE uses Pharmacy Technician Certification Board competencies as their baseline for reviewing activity objectives. and you can look on the PTCB website for their specific competencies for reference. The more clinical activities where issues arise between pharmacist and technician objectives is the main goal that we are trying to resolve. We don't want to confuse our audience members by thinking that by providing the same set of objectives for a pharmacist and a pharmacy technician, meaning each word is identical to one another, it will confuse our audience thinking that the pharmacy technician's level of education is at the same level as a doctorate of pharmacy degree, and the other way around. There are differences when it comes to our education. One is a vocational school versus another which is beyond graduate school. So those are some of the loopholes and the issues that we're trying to resolve as we are improving our ACPE accreditation status. So what do you want learners to be able to do as a result of completing an educational program? Not what the speaker will do. So for example, you're going summarizing key findings of enhanced study. Enhanced usually stands for a name of a trial that is then cut into a word that makes an easier way of saying it over and over again when speaking to other colleagues about this study. The objectives should be observable and measurable. For example, apply strategies for identifying high potential and emerging leaders. The verb list for objectives, do not use these verbs because they are considered not observable. Understand, learn, comprehend, or know. Oh, I didn't know that. So these ones that are acceptable for listing as objectives in a CPE are the following: explain, describe, identify, compare and contrast, distinguish, define, state, outline, select, differentiate, evaluate, interpret, list, apply, demonstrate, summarize. Those are more likely for the pharmacist objectives. For pharmacy technician objectives, examples of acceptable CE content for pharmacy technicians must include the following: medication distribution, inventory control systems, mathematics, biology, pharmaceutical sciences, pharmacy law, and pharmacology or drug therapy. And when reviewing these slides in order to approve for CE session and ACPE accreditation, the last slides should contain the following: test questions. It is recommended to have 3 to 5 questions per 1 hour of instruction. 1 hour equals to 0.1 CEU. References and bibliography are also required. We want to be able to provide learners not only with the information from the speaker, but with the sources that they used, as well as additional resources needed for further study. One thing we want to look out for when reviewing these PowerPoint slides are bias. Corporate consultant logos on every slide may or may not be needed. However, if there is financial disclosure that the speaker has with a specific company, we will not be able to accredit their CE session. However, let's say they work for a school of pharmacy and they're a current PGY1 resident, it is acceptable and okay to have the logo of their hospital or institution their academic program on each slide, should they choose to want to represent themselves as well as their residency program in such a fashion. The second point, the use of trade names when a generic name would suffice. So this is brand versus generic. Presentations must give a balanced viewpoint of therapeutic options. And also, if there are multiple brand names, they should be all used if possible. And we know in pharmacy school, the amount of names that belong to one generic drug can be as long as a list of Santa Claus's naughty and nice list. So be able to recognize the brand names and make sure that they match the generic name as possible. An additional consideration for when reviewing your slides that of an applicant. We want to keep in mind the number of slides. We don't want it to be too lengthy or too short. Be mindful that you have 1 hour on average or an hour and a half to present a topic for discussion, and roughly about 1 minute per slide is a good average time. So you don't want something that's more than 50 plus slides. You would need to work with the presenter on shortening those slides. You also want to make sure that the presenter's slides are not too wordy. Wordiness can lose the audience's focus as well as attention on the topic at hand. Bullets versus numbering. Numbering implies hierarchy, whereas bullets imply equal importance in a list. If you notice on a speaker's slide that they are trying to explain something in more of a step 1, step 2, step 3 state, numbering will probably be more efficient and effective in its delivery. But if you are listing the different brand names all together, which they all equal to more or less the same active pharmaceutical ingredient of a generic drug, bullets will then be the more sensible choice. We also want to be mindful of dark backgrounds as well as typos. These are more of aesthetics. We want to have the audience members appeal to the slides as the speakers are talking. So you want to keep things plain and simple in terms of its delivery, even on how it looks in the background. A note on PowerPoint presentations. A PowerPoint is not mandatory, however, there are alternatives. This is a 2013 PowerPoint presentation, and in 2022, we have changed things dramatically where every CE session is held virtually. And in order for our audience members to fully engage in the speaker's topic of discussion at hand, PowerPoint has become necessary. I am unsure if our rules are changed with the most recent ACPE accreditation review that took place in April 2022. But I will say that a PowerPoint is very highly recommended. I am not sure if it's at that point of being mandatory or not, but for the past 2 years that I've been working at CSHP, I have seen a PowerPoint presentation for every single CE session I have hosted or personally attended for my own continuing education needs. And the last point here is that active learning is what is most important. So making sure that these presenters have their test questions at least presented at the end of the presentation. They sometimes show it at the beginning, have you think about it throughout the presentation, and then reveal the answers to you at the end. Either way, we want to make sure that we're keeping our audience members engaged. And that's it. I hope this was helpful for you. Thank you. Dr. Antonio, out.